This is part 2 of a 3-video series of how our body type affects our strength with different movements. The first video in the series highlighted my favorite exercise, the deadlift. It also went into greater detail on the inspiration of the series and the main takeaways of the series as a whole. Today's video will cover another one of my favorite exercise and an exercise that gym bros around the world can bond over, the bench press. The science in today's video is relevant for the barbell bench press, the dumbbell bench press, and any other upper body horizontal pressing movement. The whole point in this video and this series as a whole is not only to educate you on the science of how anatomy affects our strength, but also to remind you that it's really not fair to compare yourself to others because there are so many variations in human anatomy and physiology and so many factors that play into what makes us who we are. Comparing yourself to anybody else isn't fair to you and it's not fair to others. With that being said, let's get into how our anatomy affects the bench press. As most of you know, the bench press is a horizontal pressing exercise that is typically performed lying supine on a bench. There's all kinds of variations for the bench press, as you know, depending on how many angles the bench you're using can adjust to. For the sake of simplicity for this video, let's assume that we are talking about the standard supine flat barbell bench press unless otherwise stated. Just as with the deadlift, the first anatomical factor that we have to keep in mind that plays into this exercise, but also any exercise in existence, is the distance that the weight has to move. The shorter the distance the weight has to move, the easier the exercise will be, and therefore the more weight that you'll be able to lift. It's just a basic principle of biomechanics and physics. If we consider one full rep of the bench press being characterized by starting with the bar held straight over your chest, elbows locked, bringing it down to the chest or upper abdomen, and then bringing it back up to the start position, we'll consider point A being the start and end position and point B being the touchdown to the chest position. The distance between point A and point B for the bench press is dependent on both the person's anatomy but also their setup and technique. Anatomically, it's very simple to understand the type of people that will have an advantage versus a disadvantage with the bench press. People with shorter arms will have a shorter distance to move the weight from a point A perspective, whereas people with larger chest musculature, broader rib cages will have a shorter distance to move the weight from a point B perspective. So it's easy to see that anatomically speaking, people who have shorter arms and a broader rib cage or broader chest will have the greatest biomechanical advantage for the bench press, whereas people who have a thinner, smaller chest, smaller circumference rib cage, and longer arms will have the greatest disadvantage for the bench press. Now, you can fall anywhere on that scale. You might have shorter arms but have a very thin build. You might have long arms but have a larger chest or rib cage. You can fall anywhere on that scale. Luckily for the fellow gangly types like myself, you're not doomed to just whatever your anatomy is for the bench press. The other half of the equation is your technique. Improving your bench press, like any other exercise, is mostly dependent on consistent progressive overload of the exercise, naturally building your strength and neuromuscular adaptations as you perform the exercise more. But the form and technique does play a huge role into how much we can move as well. Regardless of your body type, the goal is to kind of artificially decrease the distance between point A and point B during the bench press. If you're just lying flat on your back on the bench, relaxed, back totally flat, reaching up towards the bar, there is an unnecessarily large distance between point A and point B. There's also an unnecessary amount of slack on the structures that support the weight, like your shoulders and your rotator cuff. Now, before I get hate from certain people who, let's say you're a bodybuilder or you are trying to target a specific muscle group within a specific range, if you're one of those people and you prefer to lie flat on the bench or it doesn't feel right to do it a different way, then continue doing what you're doing. Go for your own goals. Do whatever you need to do that's best for your body. That's kind of the advice that I preach on this channel in general. However, if you are looking from a scientific perspective on how to increase your performance the most with the bench press, the best thing we can do is decrease the distance between point A and point B. The first thing that we need to do to decrease that distance is increase our lumbar lordosis. Lumbar lordosis refers to the anterior curvature of the low back. All humans have it. It is a way to improve shock absorption and to keep your center of mass over your hips. What we want to do during the bench press is increase that lordosis by arching our back as much as we can without pain and while also keeping your glutes and your shoulder blades on the bench. This will help bring your lower chest and upper abdomen higher to bring that touch point, that point B, closer to point A to begin with. In addition, you'll want to squeeze your shoulder blades together on the bench. This will not only expand your rib cage anteriorly, but it'll also provide stability to the shoulders, rotator cuff, and thoracic spine, which will increase the amount of weight that you're able to move while also decreasing the risk of injury. As discussed in a previous video, the best hand grip position for the bench press is at a position where your shoulders are 70 to 75 degrees abducted at the bottom of the movement. I'm not going to go into the whole reasoning of that again. If you want, you can click on the video. Before you even grab the bar, get your back and your shoulder blades set and then mime a rep without the weight. When you bring your hands down, your elbows should be at 70 to 75 degrees of abduction from your body with your forearms pointed straight up. As with everything, there are variations that feel better for everybody. Some people like their hands a little bit closer together. Some people like a little bit of a wider grip. Do what feels best for you. Remember how we talked previously about how to breathe during exercise? This is a perfect time to put that to use. You want to be breathing in during the eccentric or lowering portion, and you want to be breathing out during the concentric or moving the weight against gravity portion of the movement. During the bench press, this is even more crucial from a performance and safety standpoint, because when you are breathing in as the weight's coming down, it's going to further expand your rib cage, which will decrease the distance between point A and point B. Then once you touch your chest and start pushing the weight back up, force that air back out. Exhale. This is going to decrease the distance between point A and point B, which will increase performance while also maintaining a normal blood pressure and oxygen delivery to your brain and muscles. Then all that's left to remember is where to touch the bar on your chest. You want to bring the bar down so it touches right around your nipple line or slightly lower depending on your hand grip. The more narrow your grip is, the lower on your chest the bar is going to touch, because there's going to be more shoulder extension and less shoulder horizontal abduction. And remember to just lightly touch the bar to your chest, don't bounce it. If you touch the bar too high or too low on your chest, you're adding several inches of bar path, which will decrease performance, and also increasing stress to your rotator cuff, which will hurt your performance, but also possibly hurt your shoulders. Squeeze your glutes tight, press down into the floor as hard as you can with your feet, and move the weight upwards. Okay, let's summarize the main points here. Number one, the shorter the distance the weight has to travel, the easier it will be to move the weight. Number two, if you're someone with shorter arms and a broader rib cage, congratulations, you've hit the genetic lottery for the bench press, and you naturally start off at an advantage. Number three, whether you hit that genetic lottery or not, you can artificially create a shorter bar path by focusing on a couple checkpoints with your technique. These checkpoints include increasing your low back arch as much as you can without pain, squeeze your shoulder blades together to open up the anterior rib cage and increase shoulder and thoracic spine stability, and take a big breath in to expand your rib cage as the weight comes down, tap the weight at your lower chest or upper abdomen, and then force the air out as you press the weight up. As always, this is what the science shows will produce the greatest performance based on your anatomy, but you need to do what is best for your body. What's your favorite variation of the bench press? Dumbbell, barbell, incline, decline? Let me know in the comments, and I'll see you next time.